everyone, and thank you for coming back for another great episode with Malachi's Message on the Toxic Mold Sucks podcast. Today, we are having on a wonderful guest. Her name is Dr. Diana Stafford. She is with the Flourish Wellness Center. And first, before we ask her some questions from the medical side, we want to hear about her actual mold story that her and her family went through. So thank you, Diana, for coming on. We really appreciate it, and welcome.
Thank you so much for having me. This is such an important, message to get out, and I really appreciate what you're doing.
So you went through mold. I've caught in bits and pieces of your story, and I would love for you to tell people about what happened to you guys.
Yeah. So it's been years ago now, about 8 years ago. So we lived in a rental house in Maryland, and we knew that there was mold there, but the landlord had painted over it, had, quote unquote, fixed it, cleaned it up, all the things that are normally said. And at the time, I was in regular medicine. I've, been in practicing medicine for almost 12 years now, so after residency and med school. And I was in regular medicine at the time. And as everyone knows, regular medicine doesn't recognize, mold illness still, which we're working on, increasing awareness, but it wasn't something that even crossed my mind that this could be affecting our health. But we did have symptoms that were unexplained at the time. So, and they were different for all the members of my family. So we have 3 kids now. We had 2 at the time. And my son was having like fatigue as a toddler. Very strange. Like toddlers have endless energy. He did not. He had frequent urination, and he had insomnia and just kind of miscellaneous rashes. And our older daughter was an infant at the time, and she had trouble sleeping in the house. So she was one of those babies that you had to like take out of the house and drive around to get to go to sleep. And now looking back, I really think that, many babies with colic really live in toxic environments. So that was her main symptom, just kind of colicky, irritable. And my husband was prone to gut issues. Like he already had gut issues. And as I've seen with many clients now, and was the case with him, when we moved into that house, his gut issues just skyrocketed, and he was really struggling, not able to eat very many different foods. His gut issues were terrible at the time. And then I had more the sort of invisible symptoms like mental health struggles, which I said, maybe it's postpartum, maybe I'm just stressed. I had been through residency and I had a busy medical practice, I'm just, need more sleep, all the things that we would normally think of. But, looking back, it all connected to whenever there was a lot of mold in our home, and it was, just being stirred up by their, efforts to clean it and not really ever get rid of it. So we ended up moving from that rental. We were planning on moving in anyway when our lease was up, thankfully. And when we moved out, our symptoms got slowly better, except for my husband's symptoms. So we did a functional med workup for him because regular medicine hadn't given any answers. And that included a mycotoxin test. And I was just mind blown whenever his results came back, because they were super, super high. And this just blindsided me because, all this time I, as a doctor trying to figure out, for my family, what was going on, never thought of a mycotoxin test because they never run one, didn't learn about it in med school. And here it comes back and it's abnormal. And I'm like, what is this? What is this? And why did I not know about it? So that was, it was great that we figured that out. It was also, it just kind of made me rethink everything with regards to, my medical career and, what kind of that looked like, because I said, okay, well, if this happened to us and, we're generally like on top of figuring things out for our health, with medical background and everything, then how many other people are dealing with this? So I delved into the research, and of course, there are millions and millions of people dealing with this, very, very common. So I decided that I wanted to bring it into my medical practice. So I was in primary care at the time. So I was actually pretty excited the day that I brought some info on mold and mycotoxins to the administration. Looking back, I was a little naive at the time. I actually thought that they would appreciate it or something. So I brought it in. I did this little presentation, and they basically were like, okay, that's nice. That doesn't fit in here. And I literally just, I was, shocked that, I don't know, looking back, it's just, it makes sense that, the system doesn't really want to deal with that because it's so messy, and money, it's all about money. So yeah, so the admin they weren't gonna do that. Insurance wasn't gonna cover it. So I decided that eventually I wanted to do my own practice and do functional medicine. And I had always been into, root cause healing anyway. So it just made sense, to include mold in that. And it takes some time, to get out of regular medicine. Like they also don't really like that whenever doctors go against the grain. So they attempt to make your life, as miserable as possible. In such things. So, I managed to get out. So, really thankful. And I've been doing mold for a few years now, and also gut, because it's, intricately connected, because everything, affects the gut, and the gut affects everything. So mold and gut are two of my specialties, and we also bring a nervous system into there in my program, which I call Root Restore, which is a 6-month program that I help people with to heal from mold. So it was a bit of a winding road, but I'm really thankful. It's a blessing to have had this experience, and just be able to share it and help people now, because again, it's so common, and it can be really, really devastating. I mean, people really still underestimate mold and the issues that it can cause. So I know. So that's a little of my story.
Thank you for sharing your story. And yes, I know. And I wanted to ask you a question about the nervous system and how mold impacts that. Can you kind of give a few examples of what that looks like?
Absolutely. So the nervous system is hugely impacted by mold. One of the ways in which that happens is by straight nervous system inflammation. So whenever we breathe in mycotoxins and the other byproducts of mold, like VOCs, and we take them in also through food, whenever we breathe them in, they catch a ride straight to the brain. There's no blood-brain barrier there behind the nose in the olfactory bulb. Those toxins go straight to the brain. So breathe it in, goes straight to the brain. And then that inflames the brain. So what does that look like? Anything from brain fog to fatigue to mold rage or other changes in behavior to other nervous system symptoms that then follow, things like ringing in the ears, things like dizziness, things like just any kind of mental health concern too. That's nervous system also. So inflammation is a huge piece of that, and direct nerve damage. So mold toxins are directly toxic to the nerve cells, and nerve cells don't recover very quickly. So the cells in the gut, for example, turn over pretty quickly, which works in our favor when we're healing, when we boost those up. But the nervous system takes a little bit longer. So we really have to take down that neuroinflammation, and we have to give it time where we're supporting the body and allowing those nervous system connections, those synapses, the transmission of information from one nerve to the next. It takes some time for that to recover. So there's a lot of ways that mold can affect the nervous system and just mess with your mind. And I think, another reason, just going back to the fact that it affects everyone differently. So, one person may feel more the rage and like intense episodes of anger, whereas another person may feel depressed, or another person just may feel very foggy. There was a study several years ago now, where they looked at the urine mycotoxin test from people with chronic fatigue syndrome, which also relates to the nervous system, and 93% of them had positive mycotoxin tests. So it highly correlates with all, nervous system, even like neuromuscular, because it can cause, fatigue and muscle aches and peripheral nerve pain as well. Even to the extremities, to the arms and legs, it can cause numbness and tingling. Even the peripheral nervous system symptoms can also relate to mold.
The mental health issues, that's a big subject that a lot of people, talk about because it does affect your mental health. And I mean, I know you had depression. Was there any other kind of mental health things that you
Yeah.
experienced when you were exposed to mold that just wasn't you?
Oh, absolutely. So I'm generally a pretty upbeat person, and I just felt so depressed, but also anxious. With my clients, I would say even more anxiety than depression. I think because it puts you in fight or flight, mold does. So you're not sleeping well and you kind of feel like on edge all the time. People describe like a short fuse. And even if it's not like anger, it can be just like stress, like instantly you're stressed out, like, where are my keys? And then you're like, like you're not just like, oh, like I'll find them. You're like so stressed about something small because you're inflamed again. So anxiety is a huge one with mold, and I did have that. And again, it's like something that we write off pretty frequently as situational, which all these things come into play, of course, but I think the environment is still a huge piece that gets ignored with regards to anxiety, depression, and just out of character mood swings. So I think anytime anyone is having mood swings that are out of character, a lot of times we think, oh, it's hormones as well, which it can be hormones because mycotoxins can also affect your hormones, like zearalenone, case in point, is a hormone disruptor. So, many studies show that it's estrogenic. So, we can have hormone imbalances caused by mold. I see low progesterone. I see a lot of hormone imbalances too. And so it's like we see the downstream effects, but we're just blaming those, but we have to go back to like, what is the root cause of those effects?
I suffered from severe debilitating anxiety attacks when I was exposed to mold. I'll never forget, I was walking up the stairs and out of nowhere, I've never had any issues with anxiety attacks, never experienced one. And then it just came on suddenly. And to the point to where I couldn't get myself off the floor. And my husband had to come home and literally give me medication. That was the only way it knocked me out of that anxiety attack. And I continued to experience them while in that home until we left. And when we left, I think it went away within a few weeks. Never had it again.
Amazing. Yeah, yeah. Um, it's so striking how that can happen. I also was on medication, but the meds weren't helping because it's like it wasn't getting to the root cause. So I just, ended up stopping them, and then eventually figured out it was the mold. But agree, pretty crazy.
And the hormone imbalance, that's something I also, and many people, females, because it affects your hormones, have changes in their menstrual cycles. Can you kind of give more of how mold affects the hormones and what that looks like?
Yeah, absolutely. So it can affect all of our hormones. So hormones, there's so many different categories of that because it affects, your cortisol. So you can be, it always multifactorial. You can be waking up in the middle of the night because of cortisol and histamine and fight or flight from mold. And you can have estrogen imbalance because of toxins like zearalenone that are estrogenic. You can have low progesterone. You can have thyroid hormone issues. Like all the different categories of mold or of hormones can be affected by mold toxins. So, thyroid hormone issues are huge too. Like your thyroid hormones can have trouble being converted to the active form and used by the cells. and, adrenal fatigue, adrenal dysfunction, your adrenal hormones. I have a lot of clients who need support in the area of hormones, while we're getting rid of the toxins and, the associated inflammation. And then in many cases, you're able to wean down on those hormone supports once the toxins have, once you've been detoxed from mold. So it's, it's powerful. Detoxing is powerful for this because, everything is a feedback loop, because once one level of hormones in the hormone pathway normalizes, then, it puts the stress off of the other pieces of that pathway. So they're able to normalize and you're able to feel better. And yeah, those irregular menstrual cycles, huge issue with mold. I mean, I've seen everything from, periods straight up just stopping to periods becoming more heavy and painful, and, every couple of weeks having period, things like that. So it can run the gamut depending on the person. So yeah, I think it just underscores the fact that, mold can affect different people differently. It depends on what kind of mold you're exposed to and what your particular, what your predispositions are, genetic predispositions as well, any kind of MTHFR and HLA, predispositions to being affected by mold. Like all those things come into play here.
A big issue that we all see a lot of is marriages and how mold impacts somebody's marriage when one spouse, let's say, isn't as sick or isn't sick at all from mold, but the other one is impacted. Do you deal a lot with that in your
I
practice?
definitely do. Yeah, I definitely do. So I've seen it, yeah, both ways. I've seen both the wife affected by mold, and also the other way around, the husband, affected by mold, which is why I tried on my social media, for example, I try to kind of like give a voice to both sides there, because I've seen it both ways. It's a very significant factor in many separations and divorces, I truly believe, because I've heard so many stories of people they just change, and they change, and if they're the one that has changed, but they're also the one that doesn't believe in mold or what's going on, then it's very difficult for the partnership to continue, because we have the other person over here who's maybe not as sick, but trying to convince you like, oh, this is why you're sick. But then the person who's affected more doesn't want to get labs or doesn't want to investigate the home. So like, I feel like that combination is when the outcomes are the worst. If I've seen a lot of times, when the one in the partnership who is affected more is the one who sought out the information and who has found it and who like finds me, for example. And, if that is the case, then I have definitely convinced, wives and husbands like on the Zoom, like I will literally convince them as part of a visit, because, if they can get onto that video, like I can convince them. If they're willing to come to the visit, if they're willing to take that tiny step, I can bring out the data, bring out the studies, because a lot of times the husband just needs like a little more concrete data, because, this emotional or like this very invisible, like toxins are affecting you, but they're invisible and we can't see them, but they're, ruining your life. And then they're like, that doesn't compute, that doesn't add up for me. But when you say, okay, this is exactly how that works, and, this is causing neuroinflammation. This is upregulating, hormones. This is because of genetic predisposition and the state of the gut and the state of the nervous system. Then some of that usually will get through and, kind of make more sense. Like, oh, this is, a medical issue. This is not some nebulous, pseudoscience thing. This is, there's bacteria that are invisible, we can't see when, oh, we can't say, oh, this is strep throat, I'm not going to get that, I'm gonna block that. It's like we have been exposed to microscopic things that we believe in every single day in regular medical science, bacteria and viruses, and fungus is just another microorganism that those toxins are just another invisible thing that is part of science that is if we kind of frame it like that with the science, then it's accepted more. But yes, going back to your question, I fully believe, and it's just heartbreaking to see that how many marriages and relationships and families that mold breaks apart, and sometimes without people even realizing what happened and that it was related to mold, and then the cycle can repeat.
Right now, there's a big news story going on. Have you seen it about them trying to smuggle fusarium mold in to this country as a
Goodness.
bioweapon? And it's one person commented, who's in the United States, she was like, oh, they care about mold when it's being smuggled in to be used as a bioweapon, but not when it's growing in our homes and impacting
Yep.
health, you know? So, because they were listing, all the things that it can do, liver damage and so forth, and why it's really bad. But here we
Mhm.
have a huge epidemic going on in our homes and nothing.
So true. I mean, Stachybostrys has been used as a bioweapon too, I believe. It's not the first time, so I'm not surprised, but yeah, it's mind blowing, and yeah, it goes back to like who's responsible, and how is this all, is policy change, which I know are both, advocating for in our own spheres, but yeah, I have to look at that for sure.
Speaking of our hopefully our near future, but did you see when they mentioned that they were looking into mold as a root potential cause for the autism
Oh
increase?
yeah, yeah. So I mean, I fully believe that as well. Mold it's literally neuroinflammation. Like autism is a neuroinflammatory disorder. So, and I know there's many layers, to like, okay, autism acceptance, and I understand that. But I did pediatrics, too, for a long time, and I saw a lot of kids, lots of kids with autism, and just working on their diets, taking out some of these toxic foods and dyes, and foods that probably had a lot of mycotoxins really would help their behaviors. And yeah, so autism, pans and pandas, it can trigger very easily all of these neurologic based disorders. And yeah, I mean, I definitely agree that that is one of the reasons why autism has been on the rise, is mold and all of its byproducts, including mycotoxins. So yeah, I mean, super important conversation to have, and it would really help everyone if that was more were to be more mainstream, which hopefully will be in the near future.
I think it's such an important subject, because I've seen so many kids that were misdiagnosed as autism because they were exhibiting symptoms that looked like autism, but really it was neuroinflammation causing their symptoms and their challenges, and they no longer are on the spectrum anymore once they figured out it was mold and they got them detoxed and healed. So I think it's very exciting that people are starting to look into mold as potentially being a culprit into that subject of autism.
Yes, absolutely.
And then you have a new book out called Conquering Mold.
Yes.
Can you
Yeah, so
talk
it's funny.
about what that's going to
um,
cover?
what?
What's in your Conquering Mold book? What's that?
Yeah, so Concrete Mold came out just a few months ago. This book goes all the way from, it's 10 chapters. It goes all the way from what is mold,
Mhm.
to how can mold affect you, to how can you detox the mycotoxins and get rid of colonization as well. So it goes through the 4 pillars of what I do to help people to heal from mold. And these are, this is my method that I've created. So, which I call the root restore method. It's to protect the body. So first things first, always protect the body, which involves assessing and adjusting the environment, making sure there's no active mold exposure, significant mold exposure, as well starting a low toxin diet. So taking out some of those high toxic foods, like limiting grains, limiting added sugars, because mold loves sugar, and then limiting processed foods. And then some, boosting up the organ systems like liver support. So as you mentioned, mold toxins overload the liver very, very easily. So 30% of adults worldwide have fatty liver. Mold is definitely a part of that. So, if we can take off some of the burden that the liver has to deal with, it's very helpful. And then my second pillar is to open the detox pathways, which is really important when getting toxins out. If you're not having regular bowel movements, for example, then toxins will easily recirculate. So you really can't detox if you're constipated or if you're having some, lymphatic drainage issues or gallbladder sludge, bile sludge, or just things aren't moving. So really important, drainage before detox. And then the third is mobilize the toxins, and fourth is bind the toxins. So these are the 4 things that, need to be done in order to detoxify from a mold exposure. And mobilizing the toxins can be anything from just getting moving, like mold loves stagnation. So to the extent that you can stay moving, get your steps in, get exercise, any kind of movement helps. Any kind of movement that's tolerated will help. And things like glutathione also help mobilize the toxins. And then binding the toxins. Of course, binders are an integral part of any mold healing regimen. So, I use a lot of different binders. And it depends on the person. So sometimes I'll use a lot of like charcoals and clays. Sometimes I'll go more with like the fulvic acid. Probiotics are also binders. And food-based binders are really useful as well. Fiber binds toxins, and like ground up seeds will bind toxins as well. So there are a lot of different things that bind toxins, thankfully. Many natural things will bind toxins, and I see really good results with making sure to address all of these different areas. And then people have colonization, like if we see that they have a lot of sinus symptoms, or we do an organic acids test and the fungal markers are high, then we see that there is indication that there may be some biofilms with fungus and bacteria. Then I'll use some antifungals as well and antibacterials. So, things like oil of oregano, berberine, lots of different herbs are really, really powerful. And, natural medicine is wonderful because it works with our bodies. And, prescriptions have a place, of course, but I generally am able to stick to mostly natural medicine, mostly, supplements. We would call them in my regimens. And then, sinus treatments, because, we're breathing those toxins in. So, lots of, nasal sprays. I have some nasal sprays here because I was chatting with a client about them, just for clearing out, because if you still have mold in the sinuses, then you cleared out everything else and the sinuses can reseed the rest of your body. So it's important to address the sinuses too. If, there are any sinus symptoms, or if there's been any significant mold exposure, I always do, nasal sprays, sinus rinses, things like that, to go ahead and clear those residual particles, because the sinuses are very cavernous, and they're all connected, but like with very small openings. So, it's important to clear that out. So, and then things that are seen often with mold are also addressed in my book, which are parasites. So, parasites love a toxic environment. So if you, on the inside, if you have a toxic environment in the gut going on, then parasites, Candida, which I also have a book called Candida Detox, which we wrote last year as well. And that focuses a little bit more on candida because we all have yeast, the yeast candida albicans and other candida in our bodies. It's part of the normal flora, but if there's mold there, for example, then candida balance can easily, get disrupted and can easily have candida overgrowth. So parasites, candida, Lyme disease, and co-infections, very, very commonly seen with mold. So with regards to Lyme, if anyone, listening to this has a diagnosis of Lyme disease, then about 70% of those people will have also mold. So not necessarily the other way around, but still very common with mold to see, Lyme and co-infections, because if the immune system is down, then these opportunistic infections can easily, wreak havoc and reactivate. Like I see EBV reactivation, Epstein-Barr virus, if you have mono way back when, you can still have some EBV around. There's so many different things to cover in this book, but it's pretty comprehensive. So that's what and I'm working on a course as well, which is based on, my protocols and my book. But if people are saying, well, I'm going to be sort of DIYing my, healing, and they're not, able to work one-on-one with me, for example, then that's where I direct them, is to the book, to at least get like some expert guidance, like in one place, instead of like piecing together random facts from a bunch of different, videos and Facebook groups and stuff that they're in.
One of the biggest hurdles that people have when they are trying to heal from mold is the financial aspect of it, which is one of the main reasons why, we created Malachi's Message Foundation, because everything is generally out of pocket. The mold remediation, the assessments, having to find money to move if they have to. And then of course, the money needed to see the doctors that actually can test them and treat them properly for mold. I love the fact that you actually went and did a slideshow for your other group of medical people who didn't really like that. But if for those that can't afford to come and see you right now, because that's usually everybody's goal, like trying to get back on their feet so they can finally afford to go see the doctor that can help them, what are some just low cost tips that they can do themselves?
Yeah. So I would say, watch all my videos.
They are very informative.
I put a lot of information in there. If you read the captions on my Instagram videos, like I have, highlights on, mold symptoms, mold healing. And you can, put together something from that. I have, supplement lists online available. The book, as mentioned, is a way lower cost option. And like I said, I have courses in progress. So that will be another option, because, I really have a heart for that. I totally appreciate that. This stuff is all very expensive. And as I said, I've tried to fit it into the insurance model. It just doesn't fit. And I am, it's one of my life goals, and hopefully it doesn't take my whole life, to have this stuff covered by insurance. My husband and I, he writes the books with me. So he and I are working on, talking to companies to see, if some big companies would be interested in having functional health as like an add-on for their insurance plans. So, it's a big project, and I know others are working on that too, but it's definitely something that we're, actively, trying to do. It's just, an uphill battle, but, low cost things, I think, from the side of like, if someone says, I know that I'm dealing with mold, say right now, like in their place right now, and they can't leave. So I think some of the main things that will move the needle for you would be, so dehumidifiers, income, in also with ventilation, like, so dehumidifying the air, so keeping it less than 50% humidity whenever possible in all areas of the place, because yeah, I need to make a video on this because it's really crazy how in one area of the house it can be so much more humid than another area. I mean, we kind of know that, like, oh, the bathroom gets humid, but for example, but it affects mold growth in those areas. So keeping dehumidifiers or ventilating the space to make sure that it's not conducive to mold growth. And air purifiers also help to decrease the particle count in the air that you're breathing in. So, and to the extent, if there is one small area or one, just one area that has the mold, many, the room or all the rooms and the whole house are connected, as in many cases through the ductwork and things like that. But if there is one small area that has the mold, then, limiting your exposure to that area and just getting outside, breathing clean air, fresh air, definitely helps. So boosting up the body with, healthy foods, like lots of vegetables help with, detoxification, like leafy greens if tolerated. Things like root vegetables help a lot too. Bitter foods help to stimulate bile flow, which helps with toxin clearance. So anything from like radishes to like bitter greens, anything that tastes bitter to the mouth is going to be sweet to the liver. So there's lots of different foods, spices and herbs, like if you can add those to your meals, like garlic, thyme, oregano, which is the basis for oil of oregano, super powerful. Those can be really helpful with just, it's a toxin bucket issue. Like we're trying to limit the toxins going in because we don't want the bucket to overflow and cause more symptoms. So that's the name of the game here. And then if someone is saying, okay, well, I'm not in a mold exposure now, but I believe that a mold exposure from the past is still affecting me, that's a little bit, it's better, right? For detoxification because you're already out of the mold, right? That's step one, is to reduce or eliminate exposure when possible. And that's what resources should be focused on if you're in a mold exposure. I talk to people and I'm like, if you're in a mold exposure, like that's what your money should be spent on right now, getting out, getting help with that, because I would love to, work with you, but it's more important to spend resources on getting out or getting remediation done, or finding, the right people for that. But if you're already out, then yeah, I mean, we can just full force detox with, organ support and the anti-inflammatories, probiotics, gut support, nervous system support, like all the things that your body needs. So I think if someone is trying to do like a really low cost regimen, then I think the first thing that I would consider is like, does your gut need help? Because if you support your gut, then a lot of times, it will help with the entire body. So really, really quickly, there are 3 components of digestion that may need to be supported: acid, enzymes, and bile. So there's low stomach acid is very, very common with mold toxicity. So considering whether you may need acid support, and it can also help to fight off pathogens. Digestive enzymes really helpful, and then bile support through things like TUDCA or bitters. And then I also really love butyrate as a supplement because that's a postbiotic, but it's produced by the good gut bacteria, and your good gut bacteria like Akkermansia, Lactobacillus, Bifidobacterium, those take a hit with mold, and they are very fragile, and sometimes they're not able to repopulate without some help. So butyrate is a great thing to look into. So kind of like gut supplements and probiotics too, but just supporting the gut and limiting the intake of toxins through food and through the air.
When it comes to limiting the toxins through like food and stuff, the mycotoxin urine test that your husband did, where he was very high, is there a specific lab that you like to use when it comes to that? Can people order that online themselves, or do they need to go through you or a doctor?
Yeah, so I use Vibrant because they test for the most toxins as the urine mycotoxin test. Sometimes I'll use a blood mycotoxin test too. Both are good. Blood is a little bit different because it's testing for antibodies, but the urine mycotoxin test is, generally very accurate, and it will show you what your body's trying to get rid of right now. So, these things are all like very controversial because, people say, well, it's a urine test, so it's a metabolite, you're excreting that. And what if the levels in the body are different? It is possible, but it's useful information to show you what you've been exposed to and what your body's trying to get rid of right now. So we take it for what information it can give, which is important information. And that's a test that I get very frequently. People can order it. Currently, you can order this through my lab site. My website will be changing soon, so the structure of that will change. But yes, I will still be doing, toxin tests. People can get the total toxin test too, which has like heavy metals and other environmental toxins. If you're interested in that as well. But yeah, the 3 tests that I love to do, if people want to get like a full functional medicine workup, are a toxin test, a gut zoomer, which is a stool test, and that tests the microbiome, and then organic acid test, which we talked about for colonization and metabolism, can show neurotransmitter issues and things like that. So yeah, I mean, you can order it without, there are sites that, yes, you can order it without like a doctor's interpretation or a practitioner interpretation. But I don't recommend doing that because you're just going to get a bunch of red, information, and it's just going to be stressful, and you're going to have no direction with it.
Do you get asked this often about the urine mycotoxin test of how do you know that's not coming from food versus your environment?
Yeah, well, food contributes. So, and there are not a lot of people talking about this or saying it the way that I say it, but I fully 100% believe it, and it's backed by science, that both contribute to the urine mycotoxin test. I mean, they're metabolized in the same way, they're the toxins coming from food going through your gut, and then eventually they're getting out through the urine, just like when you breathe it in. So yeah, it does contribute. So if you're eating a lot of corn, for example, peanuts, grains, some of these, even rice, some, which is a grain, but not even just wheat when it comes to grains. Or like apples for patulin. If you're eating a lot, like significant quantities of those foods, yeah, it's going to increase your mycotoxin levels. But if you have, it depends. Like if your ochratoxin A level is, 100, for example, I'm not going to say, oh, this is all from coffee. I'm going to say more than likely you had an exposure. So environmental. So it depends on the levels, and it depends on the story, because I have clients who say, oh yeah, like I eat, corn tortillas and corn like with almost every meal. And then it's like, well, yeah, all the corn toxins are going to go up. So it's from both.
Mm-hmm. I asked that question because I hear that a lot on this side over here.
Yeah.
Especially for clients that are, potentially going through litigation. And
Yeah.
like, well, let's look at what you eat, because they're inspectors. We film them actually going
Yeah.
into the pantries of their homes and actually
Mhm.
photographing and filming their food and going into their fridge and their freezers so that they can try to use that down the road to show that, well, this is what you were eating. This is why your test showed potentially positive. So it's always usually recommended, I believe, to stop eating all those mycotoxin producing foods like 2 or 3 weeks in advance before you do the urine mycotoxin test, especially if you're going to do like litigation, so you don't have to have that argument.
It's true. However, it gets so dicey because how long have the toxins been stored? Like, if you know what I mean, it depends on that. I do generally tell people to stop grains and other high mycotoxin foods, a few days at least in advance, so that they can clear that and have a more accurate result when it comes to environment. But yeah, I mean, I still think that the data, like if you're really constipated, for example, and toxins are recirculating, then may still not be as accurate. But it's, yeah, we don't have like a so much clear data on that to say like in exactly 3 days and 2 hours, all of those toxins will be clear and it will be straight from your environment.
But that's why you offer so many different tests, so you can prove they're
Yeah.
actually being impacted. They're called,
Yeah.
it's in the blood, and all these other ones that you can do. The scan where I forgot what it's called that they use to look at the
The
brain.
neuroquant.
Yes, that was used in federal court to prove brain injury from mold in the Federico case. Do you ever testify as an expert witness for your clients?
I haven't before, I am open to it, but I haven't before. I've had several clients work with, Just Well Law and similar, well, some other groups too, but and just like sent the records over. But yeah, I mean, it's not something that I've done, but I think it's very, very important and, potentially something that I'll do in the future. We'll see.
Well, thank you again for joining us today. It's been a pleasure getting to know you more and learning about this amazing book that you have out there that people can get as a great resource tool to help them through their healing journey. You're known as the Detox Doc on Instagram. Can you tell people where they can find you?
Yeah, so all platforms, I am the Detox Doc, Instagram, TikTok, YouTube, Facebook, everywhere. And then my website is drstafford.com with the doctor spelled out. And that's where I work with people one-on-one through the Zoom.
Thank you, Dr. Stafford, again for
Thank you so
joining us.
much.